Hi, my name is Dr. Conti Mica, and today we're going to be talking about trigger fingers. Trigger finger is when you have swelling of the tendon, and the tendon swelling is getting stuck in the tendon sheath. Sometimes it locks to the point where you have to use your other fingers to unlock it. Sometimes injections help with the swelling around the tendon, but if that doesn't help, we talk about surgery. The day of surgery, you will not have an IV, but you will be getting local anesthesia. In the pre-op area, I will prep out your hand, I will inject the local anesthesia, and we will allow it for 10 to 15 minutes to set up before bringing you back to the operating room. Once in surgery, you will be transferred from your stretcher onto the operating room bed. We'll get you prepared and in a comfortable position, and then we will be prepping, meaning cleaning your hand, and then placing drapes. You'll be awake for all of this, and don't worry, we're there with you the whole time. I'll ask you during the surgery if you want to watch. If you want to watch, that's great. If you don't want to watch, that's perfectly normal as well. We will release the tendon sheath and we will place 2 to 3 sutures. And at that point, we'll put a small dressing on your hand. You'll go back to the recovery room where at that point, your loved ones can come and pick you up and you can go home. During that first 24 hours, I ask that you work on range of motion on your finger so it doesn't get swollen. You're more than welcome to place ice on it, and I ask that you work on pumping your fingers in a bending and extending and making a fist and straightening it out kind of fashion. At 2 weeks is when we will remove your sutures, and that's when you can start showering. In the interim, I ask that you wear a glove to cover your hand. 2 to 3 days after surgery, you can take the dressing down and just place a Band-Aid. I ask for those first 2 weeks that you do no heavy lifting. Heavy lifting means 5 pounds or more. After your 2-week visit, your restrictions are alleviated and you can lift as much as you want. When I see you at 2 weeks and the sutures are out, we will evaluate your incision and your swelling in your hand. If you have a lot of swelling and stiffness, we'll send you to therapy. If you do not have swelling and stiffness, we will not need to do therapy. At that 2-week visit, we'll make a decision if we'll see you at 6 weeks or at 3 months, depending on how you're doing. If you have any questions, you're more than welcome to come to clinic early, or you can call us over the phone or contact us through MyChart. We'll be answering all of your questions through there.